This is my experience with the Rezum procedure and recovery. Before the surgery, I looked up quite a few videos in YouTube, but most of them look like infomercial, and there was very little real information about the recovery. So I am creating this video. The Rezum procedure can be water vapor based or laser based. You have to ask your doctor which one they will be using. But basically it burns off some of the tissues in your prostate. These are the tissues which have grown over time to block the renal canal, which allows the urine to flow from the urinary bladder to out of your body. After the surgery, you will probably be using a catheter which will be passing through your penis and going directly into the urinary bladder. In the process, as it passes directly through the prostate, it protects the lacerated areas from being exposed to urine for the next few days. My surgery happened over 10 days ago. During the day of the surgery, you don't get to eat or drink anything for 7 hours, and after that you can be given a sedative or a spinal tap, but generally you are not given a general anesthesia, which is far more stronger. So ask your doctor which one will be good for you. After the surgery, once the effect of the anesthesia goes away, there is some amount of pain and discomfort in the lower abdomen and the penis area. The pain and discomfort continued for about 48 hours. It can be reduced to some extent by pain medication, but being a heart patient, I could not take too much pain medication. Now, you will not be feeling the burn of urine passing through the prostate which has just been operated on, because you will be having a catheter. Passing of stool becomes difficult temporarily because the moment you start giving pressure, then the lacerations in your prostate will create or provide discomfort and pain. There will be also a considerable amount of bleeding or leakage through your penis due to this pressure. So if you have blood coming out through, or red bodily fluid coming out through your penis, that's typically leakage, and that's the dead cells, mostly the dead cells coming through the lacerations from the prostate. I, as a heart patient, take blood thinners, so my bleeding was little longer than other people. But taking some prevention against this bleeding is not a bad idea. The longer you can keep the catheter, it's better, because as the urine starts passing through the prostate, then you may get burning sensation like I did as the urine passes through it. In my case, my doctor kept the catheter for 7 days. Even after 7 days, when he took out the catheter, the first 12 hours was very painful, or peeing during the first 12 hours was very painful, and it burned a lot. Even now, after 10 days, if I drink a little alcohol or coffee, then there is some burning sensation. The doctor will be providing you 2 or 3 medicines for a week. This includes one antibiotic. Please make sure that these medications do not challenge your existing or interact with your existing medications if you have any. Now, most of these medications are pretty mild on the body, but still, and they are very effective too. Some people get a catheter through their belly button, etc. But I don't know about that. In my case, it was through the penis, and the catheter passes through the prostate where the surgery has been performed. So it essentially doesn't allow the urine to pass through the catheter, hereby protecting the lacerated region. The catheter is inserted through the penis. Now, since this tube, the catheter tube, is pretty large as compared to the opening of the penis, etc. So, there is a swelling in the penis or around the penis area, and there is a little bit of discomfort. I will request everybody to carry the smaller bag. They will probably provide you 2 bags. One is a larger bag and one is a smaller bag with a smaller tube. Uh, uh, the smaller bag is much more handy because it allows you to move around much more flexibly. There is leakage from the side of the tube through the penis, and this leakage mostly looks like blood, but it is not blood, or it is mostly the dead cells from the lacerations in the prostate. And there is nothing to be too much afraid about this, but this is something which keeps on happening for about the next 7 days. Even after 7 days, when you start peeing without the catheter, you will notice little bit of blood coming out or red substance coming out before, and that's something which I have heard goes away after 2 weeks. So this was all my experience, and I am trying to educate other people based on what to expect. Even though many people say that this is an easy surgery and you just go home and start your regular life, that's not a true statement. If you try to get it on a Friday afternoon, then you will get Saturday, Sunday off, and then Monday maybe you will be able to go to work. Maybe, I said, but I would say keep 3 or 4 days on hand, because there is certain amount of discomfort with which you may not be able to work or go to offices.